Hello everyone. Today, we will discuss a common and important topic, erectile dysfunction, ED. We'll cover three key points. What is erectile dysfunction? Treatments for erectile dysfunction. Natural remedies for erectile dysfunction through fruits. Erectile dysfunction, ED, is the inability to achieve or maintain an erection firm enough for sexual intercourse. It can occur occasionally or be a chronic problem, affecting a man's sexual health and overall well-being. ED can result from a variety of causes, including 1. Physical causes. These may include cardiovascular disease, diabetes, high blood pressure, high cholesterol, obesity, and hormonal imbalances. It can also result from injury or surgery affecting the pelvic area or spinal cord. 2. Psychological causes. Stress, anxiety, depression, and relationship problems can contribute to ED. 3. Lifestyle factors. Smoking, excessive alcohol consumption, lack of exercise, and poor diet can also increase the risk of ED. 4. Medications. Some drugs, particularly those used to treat high blood pressure, depression, and other chronic conditions, can have side effects that include ED. Treatment for ED depends on the underlying cause and can include lifestyle changes, therapy, medication, or in some cases, surgery. Medications like sildenafil, Viagra, are commonly used to treat ED. Treatment of erectile dysfunction. Erectile dysfunction, ED, is treatable with a variety of methods depending on its cause, ranging from lifestyle changes to medical interventions. Below is an overview of the common treatments. 1. Lifestyle modifications. Exercise. Regular physical activity improves blood circulation, helps maintain a healthy weight, and boosts overall cardiovascular health, which is critical for erectile function. Diet. A heart-healthy diet, such as the Mediterranean diet, can improve blood flow and reduce the risk of conditions that contribute to ED, such as obesity and diabetes. Smoking and alcohol reduction. Quitting smoking and reducing alcohol intake can significantly improve ED symptoms, as both are linked to poor blood flow. Stress management. Reducing stress and managing mental health through meditation or therapy can alleviate psychological causes of ED. 2. Oral medications. Phosphodiesterase type 5, PDE5, inhibitors, common drugs, include sildenafil, Viagra, tadalafil, Cialis, vardenafil, Levitra, and avanafil, Stendra. These medications enhance the effects of nitric oxide, a chemical the body produces to relax muscles in the penis, allowing increased blood flow. Effectiveness. These drugs are typically effective for most men with ED, but they require sexual stimulation to work and should be taken before sexual activity. 3. Hormonal therapy. For men with low testosterone levels, testosterone replacement therapy, TRT, can be prescribed. This can be administered through injections, patches, or gels. Hormone imbalance is less common, but can sometimes be the cause of ED. 4. Psychological counseling. When ED is caused by psychological factors like anxiety, depression, or relationship problems, counseling or therapy can be beneficial. Cognitive behavioral therapy, CBT, is one common approach to managing ED, related to stress or emotional issues. 5. Vacuum erection devices. These devices involve a pump that creates a vacuum around the penis, drawing blood into it to produce an erection. A ring is then placed at the base of the penis to maintain the erection. This is a non-invasive option for men who prefer not to use medication. 6. Penile injections. Medications such as alprostadil can be injected directly into the side of the penis to produce an erection. These injections increase blood flow to the penis, resulting in a firm erection suitable for intercourse. 7. Surgical treatments. Penile implants. For men who do not respond to other treatments, surgical options like penile implants may be recommended. Implants involve placing inflatable or malleable rods inside the penis to manually create an erection. Vascular surgery. In rare cases, Vascular surgery is performed to repair arteries and improve blood flow to the penis, particularly in younger men with physical trauma. Fruits that can help in the treatment of erectile dysfunction, ED. Several fruits are known to improve blood circulation, boost nitric oxide levels, and provide essential nutrients that support sexual health, potentially alleviating symptoms of erectile dysfunction, ED. Below are some fruits that are beneficial for treating ED. 1. Watermelon. Watermelon contains citrulline, an amino acid that helps relax blood vessels, similar to how drugs like sildenafil, Viagra, work. Citrulline boosts nitric oxide production, improving blood flow to the penis and supporting better erections. Watermelon is often called natural Viagra due to its effects on circulation. 2. Berries. Strawberries, blueberries, blackberries. Berries are rich in flavonoids, which have been linked to a reduced risk of ED. Flavonoids help improve circulation and keep blood vessels healthy by promoting nitric oxide production. 3. Pomegranate. Pomegranate juice is high in antioxidants, which improve blood flow and reduce oxidative stress. Improved circulation can lead to better erectile function. Pomegranate is also thought to help with heart health, which is closely related to erectile function, as cardiovascular health impacts blood flow to the penis. 4. Bananas. Bananas are a great source of potassium, a mineral essential for heart health and proper blood circulation. Good circulation is key to strong erectile function. Potassium helps control blood pressure, ensuring that blood flow to the penis is not restricted. 5. Apples. Apples contain quercetin, a type of flavonoid known to help improve blood circulation and lower blood pressure. These factors are critical in reducing ED symptoms. Apples also promote cardiovascular health, which can directly improve erectile function. 6. Citrus fruits. Oranges, grapefruit, lemons. Citrus fruits are rich in vitamin C and flavonoids, which help improve circulation and blood vessel health. Regular consumption of citrus fruits has been associated with reduced risks of ED and improved overall sexual health. How fruits help ED. Nitric oxide production. Several fruits, like watermelon and berries, contain compounds that help boost nitric oxide levels in the body, which relaxes blood vessels and improves blood flow, essential for strong erections. Heart health. ED is often linked to poor cardiovascular health. The antioxidants and nutrients in these fruits help protect the heart, improve blood circulation, and lower blood pressure. Hormonal balance. Some fruits, like avocados, contain nutrients that support hormone production, which can enhance sexual desire and performance. Including these fruits in a balanced, heart-healthy diet, alongside regular physical activity, can contribute to improving ED symptoms naturally. While these fruits are beneficial, they work best when combined with a healthy lifestyle and medical treatments if necessary. Now we'll highlight 6 vegetables that are great for boosting sexual health and improving ED naturally. First on our list is spinach. This leafy green is packed with folate, a key nutrient that promotes blood flow. Low folate levels are linked to ED, so adding spinach to your diet can help improve circulation and overall sexual health. Plus, its high magnesium content helps lower inflammation, further supporting vascular health. Next up is beets. Beets are rich in nitrates, which your body converts into nitric oxide, a compound that helps relax blood vessels and improves blood flow. Improved circulation is crucial for achieving and maintaining an erection, making beets a great natural remedy for ED. Another fantastic vegetable is carrots. Carrots are full of antioxidants like beta-carotene, which support healthy blood vessels. By reducing oxidative stress and promoting good circulation, carrots can help combat. Garlic is well known for its heart health benefits, but it can also help with ED. Garlic boosts nitric oxide levels, just like beets, which helps dilate blood vessels and improve blood flow to the penis, making it easier to maintain an erection. The effects of ED caused by poor blood flow. Another key player is tomatoes. Rich in lycopene, an antioxidant that improves circulation and heart health. Tomatoes may enhance blood flow. A healthier heart means better blood flow, which is essential for combating ED. Lastly, Broccoli is packed with vitamin C, which helps improve blood flow by supporting healthy blood vessels. Broccoli also reduces inflammation, which can further aid in reducing the risk of erectile dysfunction. Incorporating these 6 vegetables, spinach, beets, carrots, garlic, tomatoes, and broccoli, into your diet can help improve circulation, boost nitric oxide levels, and support overall vascular health. By eating these foods regularly, you may see a natural improvement in your sexual health and erectile function. So, make these veggies a part of your daily routine and take charge of your health.